Hi, my name is Brooklyn Mahar, and today I'm going to be talking about mathematics in the nursing field. I will be talking about math in the nursing field because nursing is the career I will go into when I reach a certain age in my life. And I just wanted to know more about nursing and what knowledge I have to know in order to be successful in the nursing field. To start off, what is a nurse? A nurse is basically someone who gives medical attention to a sick person. Nurses range from being LPNs to RNs to CNAs, and nurses range from working as home help nurses, working in hospitals. It just depends. But you all have to know the same knowledge. A nurse has to have mathematical knowledge to complete IV drips, dosage calculations, converted measurements, and intake and output. IV drips. An IV, which means intravenous drip, is when you allow fluid to enter the body by either a tube or a needle into one of the veins. When IV medicine must be given without an electric pump, the nurses have to calculate the correct amount of drops per minute to give to the patient. Calculating dosages. Calculating dosages in the nursing field is very important. To calculate the right amount of dosage, the nurses use the patient's weight. Some things that involve calculating doses are prescriptions, flow rate setup, and syringe draw up. Converted measurements. Measurements in medicine are based on the metric system. To provide safe care, pounds must be converted to kilograms, ounces to cubic meters, Fahrenheit to Celsius, and inches to centimeters. Intake and output. Nurses have to calculate intake and output of their patients, which means they have to add up every cubic centimeter of fluid taken in by route or option and the amount voided or released from the body. Intake and output is very important because the doctors usually look at the nurses as a way to understand what's going on with the patient and why their body is allowing or rejecting certain medications and fluids. So in conclusion, nurses have to have mathematical knowledge to convert measurements, complete IV drips, chart intake and output, and calculate the right dosages.